Tuberculosis, a comprehensive overview. Tuberculosis, TB, is a global infectious disease caused by the bacterium Mycobacterium tuberculosis. Despite significant advancements in medical science, TB remains a serious health concern, particularly in developing countries. This article aims to provide a comprehensive overview of tuberculosis, including its causes, symptoms, diagnosis, treatment, prevention, and its impact on public health. Causes and transmission. Mycobacterium tuberculosis, the causative agent of TB, is an airborne bacterium that primarily affects the lungs but can also spread to other parts of the body, such as the brain, spine, and kidneys. TB is transmitted through the inhalation of tiny airborne droplets containing the bacteria, which are released when an infected person coughs, sneezes, or talks. However, not everyone exposed to the bacteria becomes sick, as the immune system can often control the infection and keep it in a latent state. Symptoms. TB can present in two main forms: latent TB infection and active TB disease. Latent TB infection occurs when the bacteria are present in the body but are kept under control by the immune system. In this state, individuals usually do not exhibit any symptoms and are not contagious. Active TB disease, on the other hand, occurs when the immune system fails to contain the bacteria, leading to the development of symptoms such as persistent cough, fever, night sweats, fatigue, and weight loss. Coughing up blood is also a characteristic symptom of advanced TB. Diagnosis. Diagnosing TB involves a combination of clinical evaluation, medical history, physical examinations, and diagnostic tests. These tests may include skin tests like the tuberculin skin test, TST, or blood tests like the interferon gamma release assay, IGRA. Chest X-rays, sputum tests, and molecular techniques like polymerase chain reaction, PCR, are also used to confirm the presence of the bacteria and determine whether the infection is latent or active. Treatment. The treatment of TB involves a combination of antibiotics over a specified duration. The most commonly used antibiotics include isoniazid, rifampin, ethambutol, and pyrazinamide. Treatment regimens can be lengthy, often lasting 6 to 9 months or more, and it is crucial for patients to complete the entire course to prevent the development of drug-resistant strains of the bacteria. Drug-resistant TB is a growing concern and can be much more challenging to treat. Prevention. Preventing the spread of TB involves a multifaceted approach. Vaccination with the Bacillus calmette-guerin, BCG, vaccine is used in many parts of the world to protect against severe forms of TB in children. However, its effectiveness in preventing pulmonary TB, the most common form of the disease, varies. To reduce the risk of transmission, early detection and treatment of active cases are essential. In addition, improving living conditions, ensuring proper nutrition, and promoting awareness about the disease contribute to prevention efforts. Global impact and public health. TB is one of the top 10 leading causes of death worldwide. It disproportionately affects low and middle-income countries, where factors such as poverty, overcrowding, and limited access to healthcare contribute to its spread. The emergence of drug-resistant strains further complicates control efforts. The World Health Organization, WHO, has initiated a global strategy to end TB, with key goals including reducing TB-related deaths and new cases by 2030. Challenges and future directions. Despite significant progress in TB control, challenges persist. Drug-resistant TB strains require more complex treatment regimens and heightened surveillance. Socioeconomic factors, stigma associated with the disease, and inadequate healthcare infrastructure also hinder prevention and treatment efforts. Future directions in TB research include the development of new diagnostic tools, more effective drugs with fewer side effects, and vaccines that provide better protection against all forms of the disease. Conclusion. Tuberculosis continues to be a global health challenge that demands sustained efforts from healthcare systems, governments, researchers, and communities. Its impact on both individual lives and public health emphasizes the need for enhanced prevention, early diagnosis, and accessible treatment. Through continued research, international collaboration, and targeted interventions, the world can strive towards a future where TB is no longer a major threat to human health.